New pediatric study out from Spectrum Health shows minority children with cancer have higher death rates in the United States. The study looked at more than 12,000 patients. News 8's Lindsay McComal spoke with the director of research at DeVos Children's Hospital about these findings.
And we started following them linearly. So this is data from the last 9 years. And by following them linearly, we're able to tell what happened to the outcome.
Well, in terms of the big takeaways, let's talk about, the data and the disparities there and what that may mean going forward and for, future research as well.
What it exactly means is when we looked at this data, we found there were differences in terms of race and ethnicity. So you're taking the most vulnerable in our society and taking a look at them and seeing how well they do. I think it's a reflection of our society in some ways. The other part that I think was unique was we looked at regions, right? Mm-hmm. A lot of studies in the past haven't done that. So we looked at regions as defined by the Census Bureau, and the regions became the Northeast, the South, Midwest, and West. And we looked at those different regions to look at how well patients do in those regions, children with cancer do in those different regions. And I think that's the other thing that makes this unique to the way we conducted this study.
In your opinion, what's next and what other research needs to be done or what actions need to be taken to try to lessen that gap?
The other thing is we need to have concrete measures, right? We need to have parents be supported in trying to bring their kids to the hospital sooner than later. We need to be more preemptive with kids of minorities, have a little more understanding of what the challenges these parents are facing, whether it's communication with Hispanic patients so that we communicate better to them, or whether with African American and other children support, so they can get to the hospital. I mean, I grew up in Africa, right? And I saw there was so much disparity in the system because things were not available. In a country like the U.S., with the resources we have, we should be able to care for our most vulnerable populations in a better way. That to me is a big take home from this.